Let's answer 10 questions per day, all about radiography. So the first question is, which type of digital radiography directly converts X-ray energy into electrical signals? So among the options we have computed radiography, direct radiography, solid state detectors and image intensification. When we look at computed radiography, we know that there is an imaging plate which captures the X-rays and converts into latent image. Only when processed we can see the image. So that is not direct conversion. Coming to solid state detectors, it can be direct conversion or indirect conversion. So we cannot explicitly say that solid state detectors are direct converters. So that is also not the option. The last option, image intensification, it has a lot of steps involved in the image conversion. So that is also not the right answer. So the option is direct radiography. The second question is, what is the main difference between a CT angiogram and a traditional angiogram? First option, CT angiograms use contrast dye while traditional angiograms do not. We know that CT angiograms use dye and the traditional angiograms also need contrast to be injected to visualize the blood vessels. So that is not the option. Option B, CT angiograms are less invasive than traditional angiograms. This statement is true. For CT angiograms, we just need venipuncture, and for traditional angiograms, we need the puncture to be made in the arteries, and the procedure needs the catheter to be inserted to the arteries. So that compared to CT angiograms, traditional angiograms are more invasive. So that is the right answer. When we look at the option C, CT angiograms use X-ray fluoroscopy while traditional angiograms do not. That is not the right answer because CT angiograms do not use X-ray fluoroscopy. The fourth option, CT angiograms require insertion of a catheter while traditional angiograms do not. I have already discussed that, and CT angiograms do not require insertion of a catheter. So the right option is CT angiograms are less invasive than traditional angiograms, option B. The third question, what is the purpose of placing gel on the patient's skin during an ultrasound procedure? Option A, to provide lubrication for the transducer. This statement is a bit correct because the gel does give lubrication a little bit, but that is not the entire reason why we are using the gel on the transducer. So option C, to prevent skin irritation, that is also not the purpose. Option D, to enhance the visualization of blood vessels, that is also wrong. And the correct option is B, to improve the conduction of sound waves. Fourth question, what is the purpose of the detectors in a CT system? First option, to rotate around the patient. Detectors do rotate around the patient, but that is not the function of detectors. Option 2, to move the patient through the system. We have another mechanism and system for moving the patient through the system. So that is not the function of detectors. Then the third option, to produce a fan-shaped beam of X-rays. Also, that is not the function of detectors. The last option, to register the X-rays that pass through the patient's body. So that is the purpose of detectors in CT. They do register the X-rays and acquire the data that has been obtained, and that is the purpose of detector. So option 4 is the correct one. Which type of MRI scan is sensitive in identifying a stroke or ischemic injury shortly after its occurrence? Among the options are T1 weighted MRI, T2 weighted MRI, DWI or diffusion weighted MRI, and gradient echo sequence. So, among these four options, diffusion weighted MRI is the most sensitive in identifying a stroke or ischemic injury shortly after its occurrence. So the answer is third option, diffusion weighted MRI. Fifth question, which technique is used to obtain radiographs of the entire set of teeth? Option 1, intraoral examination. Option 2, bite wing examination. Option 3, orthopantomogram. And option 4, CT scan. So among these options, orthopantomogram is the right answer. Intraoral examination and bite wing examination provide only a section of teeth. So OPG gives X-ray image from right TMJ to left TMJ. So the option 3 is the right answer for this question. What is the basic structure of human body? First option, a collection of independent structures. We know that body is not consisting of independent structures. It's all connected and complex. So that is not the right answer. Option 2, a single homogeneous structure. Body is composed of a different variety of cells and tissue. So that is not the right answer. Option 3, a complex system of interconnected structures. Yes, that is the right answer. And when we look at option D, a simple structure made up of few smaller structures. That is not the appropriate answer. The best option is option 3. So that is the right answer. What is the purpose of MR spectroscopy? Option A, to measure the chemical metabolism of a suspected tumor in the brain or spine, and that is the right option among all the options. So we do MR spectroscopy to get or analyze what metabolites are present in a brain tissue or in a section of brain tissue, or like tumors or other pathologies, and by analyzing this data we can actually understand what is happening in that tissue. So it is also called virtual biopsy. So this one is the right answer. How can good occupational radiation protection be achieved in radiography, mammography and general CT? So among the options, when we look at the meaning of the statements, the third option, which is the use of structural shielding and maximizing the distance between the patient and personnel, is the right option. All the other options actually increases the patient or the occupational worker's dose. So option 3 is the right answer. Which position is recommended for acquiring an antero-posterior foot radiograph? So the options are supine or seated position with the plantar surface on the image receptor, recumbent position with the knee flexed. Third option, obliquely position 30 to 40 degrees. And the last option, weight bearing position with both feet on one image receptor. So the right answer is the first option, supine or seated position with the plantar surface on the image receptor. Option 1.